Hello everyone. In this presentation, you will learn how to document the assessment during the examination and develop the personal care plan for older adults after assessment. We have developed the digital assessment platform, which is called Trace for Assessor, to record the basic assessment results from older adults. And we will introduce how to use the paper pen forms to record the in-depth assessment results. And finally, we will introduce some key information that should be considered during creating a personal care plan for the older adults. For the in-depth assessment, we will now look at the Montreal Cognitive Assessment Form, MOCA. Please make sure to mark the scores in the corresponding boxes for each subtask as you process. Let's go through this section step by step. The first step is the visual, spatial, and executive function. In this section, mark the score for each subtask, such as the trail making, cube copying, and cross drawing, and then calculate the total score for this domain. The second one is the naming. For this task, record the response and assign score correspondingly, and then calculate the subtotal for this part. The third one is memory. In this section, there is no scoring in this stage, so please simply ask the participant to repeat 2 trials of the 5-word list. Tick or cross the boxes to indicate which words the participant could or could not record. The fourth one is the attention. For the digits band, give 1 point for each correct sequence repeat, such as the forward or backward. For the series subtraction, write down each number the participant saying. Each correct answer equals the previous number minus 7. So write the number down is important for the verification during the follow-up. The fifth one is language. In this section, for the sentence repetition, give a score if participant can accurately repeat the sentence. In the verbal fluency task, write down all the words the participants say and mark if it can generate 11 or more words. For the abstraction, which is called similarities, give a score when the participant can correctly explain the similarity between 2 pairs of words. Next, we are going to delay record. Score only the words recorded spontaneously, without any cue. If participant can record the words only after a category cue or multiple choice cue, record those separately, and then calculate the memory index score according to the official formula. Next, we come to the orientation. Mark whether the participant can correctly tell you the date, place, and orientation details. And finally, when you finish, sum all domain scores to generate the total MOCA score. Now we come to the short physical performance battery test, SPPB. The first component is balance, which covering the side-by-side stand, semi-tandem stand, and tandem stand. So measure the time for each balance test and record the corresponding score. The same procedure applying to the giant speed and the chair rise test. The total SPPB score is calculated by adding the score from all the 3 tests. So based on the total score, you can determine whether the participant performance is normal or under normal. So according to the established cut-on point. For the vitality domain, the mini nutritional assessment is used. This is the questionnaire-based scale, you need to read each question aloud to the older adults, record their answer on the form, and then calculate the total score. Finally, mark the corresponding nutritional category based on the total score. For the visual assessment, the assessor should guide the older adult to check whether they can clearly see the different size of the letter E on the visual charts. Each eye should test separately first, followed by a test using both eyes together. So we need to mark whether older adult can correctly identify at least 3 or 4 letter E's. So the procedure is the same as the Vision 2 and 4 assessment. For the hearing assessment, assessor will perform 3 tests: whisper test, rename test, and rapid test. In the whisper test, ask the participant to repeat the words or number you whisper on each side, and record exactly what they repeat. For the rename test, activate the tuning fork and place it on the mastoid bone behind the ear for a few seconds. And then move the fork close to the ear canal and ask whether the sound through the air is louder than on the mastoid bone. Mark the result accordingly. Finally is the rapid test. Place the vibrating tuning fork on top of the head. Ask whether the sound is heard equally in both ears or more strongly on one side. Record the participant's response. For the psychological well-being domains, the patient health questionnaire will be used. This is the questionnaire-based scale, and you need to read each question aloud to the older adults, mark the response for each question, and calculate the total score for this assessment. So after the assessment, please make sure you have saved the data in the online platform, which is the Quartz, and return all the materials, including the questionnaire, referral form, and the undistributed booklet, consent form, and information sheets to the university. So after you complete the assessment, you're able to create the personal care plan for older adults. So before you create the personal care plan, there's some key information need to be considered, such as the older adult's demographic information, their medical history, family illness, surgery history, allergic history, and current medication, and their general health status need to be documented before you create a care plan. So in addition to this, you also need to document their intrinsic capacity decline, such as the visual and hearing ability, nutrition status, mobility, cognitive level, emotional level, and depression symptom, as well as their social support status. So here is an example of the integrated care plan. So in the top left section, you should write down a summary of assessment findings, such as the decline of some specific intrinsic capacity, and then co-create the goals with older adults and their caregivers for the domains showing decline, and along with the recommend intervention or referrals. And finally, guide the participant to identify significant others such as the family members or friends, those who can provide support to help maintain or improve their intrinsic capacity, and try to encourage them to seek assistance or make the use of the available community resources where needed. So after providing a personal care plan for older adults, as health professional, you also need to record the care plan implementation for each client and for the follow-up. So for example, you need to write down the problems such as the intrinsic capacity decline identified through the assessment, and whether this decline is currently present or this problem is a potential risk, and to write down whether the problem is etiologic or underlying causes such as their environmental factors effects, and provide some supporting evidence such as the assessment results, observation, or data support, and to provide the goals for their rehabilitation, and also to provide the recommendation to the clients, and then to document whether the older adults or the caregiver agree or disagree to follow, and finally, to write down the actions that implement for the follow-up and support, which taken by the center staff. So this is the end of the assessment documentation and care plan developments after the assessment. If you have any questions, please feel free to reach out Professor Angela Leung, Director of the WHOCC, and Dr. Karina Oh, the postdoctoral fellow from the WHOCC. Thank you very much.